Good afternoon and welcome to Webinar Wednesday. Today we are joined by Cynerio security evangelist Chad Holmes and CTO and co-founder Daniel Brody. Webinar Wednesday would like to thank our sponsor Cynerio. Cynerio has one simple goal: to secure every IoT, IoMT, OT and IT device in healthcare environments, with capabilities ranging from micro-segmentation and improved device insight to identifying exposed PHI and stopping ransomware. Cynerio protects hospitals from a variety of modern cyber attacks. Learn more about Cynerio at cynerio.com or follow them on Twitter at Cynerio and LinkedIn. Just a quick reminder about our fall MD Expo. We're headed to the Caribe Royal Hotel in Orlando, Florida from October the 29th to the 31st. Join us for 3 days of education, networking, and the latest advances in medical technology products and services. Registration is now open, so for more details, please visit mdexposhow.com. Also, a copy of the pre-show planner can be found in the handout section of your webinar dashboard. Today's webinar, as usual, is eligible for 1 CE credit from the ACI, and you can obtain your CE certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1 CE credit from the ACI, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. Let's kick off today's webinar by giving away one of our Webinar Wednesday t-shirts to the attendee that can tell me the answer to the following trivia question. August is National Eye Exam Month, so what is the most common eye colour? Answer now using the questions feature on your dashboard, and I'll reveal the answer at the end of the webinar. We'll wrap up today's presentation with a live Q&A, so please submit your questions anytime using the questions feature on the webinar dashboard. As I mentioned earlier, our presenters today are Chad Holmes and Daniel Brody, and they will be discussing Generative AI, the future of healthcare cybersecurity. So Chad, it's over to you.
Great, thank you, Linda, and thank you everyone for joining us today. Today we have a very exciting topic we're going to talk about. You've probably heard a lot about it in the news. We're going to talk about generative AI, or as we're going to call it today, just to keep it easy, Gen AI, and how it's helping with the future of healthcare cybersecurity. Joining me today is the co-founder and CTO of Cynerio, Daniel Brody. Daniel, give a big wave. I'll give you a chance to talk here just in a second. Daniel's going to dive a lot into what Gen AI is and more specifically how we're using it here at Cynerio. And of course, my name is Chad Holmes. I am a security evangelist for Cynerio. I get to present all the good work that Daniel and our team do to make sure that the world of healthcare is more secure. Throughout today, we're going to talk about a couple different topics. If you've seen one of my presentations before, we do have a lot of repeat joiners, so thank you. I am going to talk about the state of healthcare cybersecurity just to kick it off, as I always do. I always like to give stats about why we're actually inventing this technology, protecting hospitals, and why they need protection. Today, we have 4 to 5 new stats, so I'm really excited to present those. Then we'll start at a high level. We'll talk first about what is Gen AI, right? We're not going to go too deep, but just get a baseline definition out there. Then we're going to go a little bit deeper and talk about examples of Gen AI in healthcare, so just the general healthcare space. And then we're going to dive really, really deep into how Gen AI is being used to secure healthcare and where we're going to see it going in the future. I do encourage you to ask questions as we go through. Ask questions, we'll make sure we get to them all at the end. Finally, if you don't know who Cynerio is, thank you for joining today. Cynerio is an IoT cybersecurity company that is 100% focused on healthcare. So our goal is to secure every IoT, OT, medical, and unmanaged IT device in healthcare environments. So anything from IV pumps to nursing stations to HVAC systems to the Teslas and Amazon Alexas that are on your networks and you don't even know it. We've been recognized by Gartner as a cool vendor. We've been recognized as Forrester as a wave leader, and also have very, very high scores in class reviews. So many thanks to our customers that participate in those. So if you do want to learn more about Cynerio, I'll give you some links at the end, but you can contact us at cynerio.com. So as I promised, I do like to start everything with a little bit of a discussion on the state of healthcare cybersecurity and do have some new stats for you today. First of all, every 7.1 minutes in the United States, we are now seeing a cyber attack against a hospital, some kind of healthcare facility. Meaning, over the course of this webinar, there are going to be between 8 and 9 attacks that happen on healthcare facilities, which is absolutely terrifying. And if anyone picked up the paper over the last couple of weeks, you've seen attacks that hit systems, particularly in the Northeast where I am. But they found one weakness in one hospital, and that has spread. Where Daniel is in Israel, we're also seeing cyber attacks there as well, and seeing them every place in between. So hackers have firmly targeted healthcare because they have lower levels of defense, and because we have higher rates of paying ransom and value of patient records. Next, I talked about ransomware there a little bit. 24% of the cyber attacks, of the ransomware attacks specifically, that the FBI reported on last year were healthcare. And unfortunately, this is a case where we can say we're number one yet again. We are by far the most attacked industry in the US when it comes to ransomware. And the reason for that, at least partially, is that nearly half the time, 43% of the time, we do see healthcare environments paying the ransom. And it's a very, very tough decision to make because everyone knows you should never pay ransom, but in some cases, paying the ransom is the quickest way to get back online and back serving your patients. But because those have been paid with such a high frequency, we're seeing more and more attacks. So we're the highest attacked industry, we're paying the most, and the result is not only are we paying the ransoms, but we're seeing patient data getting exposed. Right now, we are on pace for 1 in 4 people in the United States to have their patient data exposed through a cyber attack in the year 2023. That rate does not even include the 2 or 3 really, really big cyber attacks that we had in July. That's just based on data in the first half of the year. So if you're in a room with 10, 12 people right now, 2 or 3 of you are likely to have your data exposed to a cyber attack, which is terrifying. Now, the good news is there are a lot of industries out there that have adopted protections that are resulting in them not being attacked as frequently as healthcare. One of those protections is something called microsegmentation, effectively making sure all the devices that shouldn't be talking to each other don't talk to each other. So the thought is we may not be able to slow down these attacks, but we can stop the spread and impact of attacks. And if we can do that, we're losing 1 or 2 devices in an attack, not thousands and thousands. So at the end of the day, we all know there's a heavy focus on healthcare from cyber attackers. I think a lot of people don't realize how widespread it is, and I'm hoping that these stats can help in discussions you're having with your team. So with all the scary stuff out of the way, let's start talking a little bit about exciting stuff, specifically what is generative AI. So Daniel, I'm going to hand it over to you. If you can start first not with Gen AI, but just generic AI and what that is as a baseline, we'll go from there.
Yeah, so traditional AI is something that's been on the rise for many years, up until from the old kind of old school algorithms used quite a few years ago to the neural networks that have been becoming more and more popular and more common across a lot of different products and across a lot of different technologies as they're being used. And the thing that was always very prevalent with how traditional AI had to be used was it was basically all about the data, right? You had to make sure that you were working with a large set of data. You had to make sure that that data had to be very well tagged. If you're talking about supervised learning, or if it was unsupervised learning, you'd have to massage the data in a way to make sure that that unsupervised learning would hit the results that you wanted to get to. There was quite a lot of work in managing that data, how you do training across all that stuff. And lastly, there was had to be a very well-defined a goal, a very well-defined success function or scoring function, right? And using that, you could train your AI. So you could go through all this amount of data and make sure the model knows based on that function to detect what a cat is from a picture, or to detect if a piece of text is a phishing email, right? And that would be something that would be continuously run, continuously improved, and it would take a lot of time. If you look at data teams at companies, there would be pretty big teams with a data scientist, a data engineer, and a data analyst, and a lot of also data itself, which there would be outsourcing in terms of how they tag and manage and do all that effort. And that backlog of effort meant that the more data you had, the better your AI systems were. So that was a big bottleneck for a lot of organizations to be able to adopt AI in a very customer specific way or in a very product specific way. And that's one of the things that is the biggest change, I think, was generative AI. So if we look at generative AI, it's trained on a lot of data, existing data on the internet, and basing on that, the ability to basically they create content. Generative AI comes from being able to generate, right? Whether it's generating text or images or audio or whatever it is. And the beautiful part of it is if you can create or define your problem in a way where it is a subset of generating data, then you can tap into this very large, very well existing and very well trained model that you can tap into from OpenAI, Google, or whoever it is that you're getting this model from, and that allows you to significantly reduce the effort you need to build out what you want to build, right? So if we're going back to classifying a email as a phishing email or not as a phishing email, all of a sudden it's much easier. You just need to phrase your question or phrase your prompt to the solution, and hey, is this a phishing email? And you will be able to generate an answer of yes or no. And obviously, it's a little bit more nuanced than that. You'd want to do a little bit of additional training on it or context or examples, and it does require more work, but it still requires significantly less work than being able to create that data originally. And lastly, and this is I think one of the most important pieces, is that success function, right? If you have a success function and you're not 100% sure what it is, you don't really know how it should look like, right? It sometimes require a lot of finesse to know what the right model is when traditional AI and what the right function is. All of a sudden, it could be a little bit more gray area. Yeah, if you do more work, you might be able to bring up your success from 80% to 95%, but you can come with something that's not incredibly well defined. Your data might not have been massaged the right way to get the data out. You're not really sure how that success function looks like. You're not really sure what the model looks like. And you can get to a pretty good solution with significantly less resources than you had to in the past. And at the end of the day, the big piece this provides organizations the tools to easily enhance their existing technology and not require now a huge data team to come and sit and develop the specific thing that they would need for their organization. It allows them to build new offering with relative ease. We're seeing this across quite a bit of industries where we're seeing this being rolled out for generating the data and helping reduce a lot of manual effort that was required beforehand. I will say a little caveat, it really only works in places where you can build the task that you want to get done as a derivative from generating AI, right? It's not something you can just take a picture of random things and that it hasn't been trained on and have it detect a tumor from a DICOM image, right? That's something that LLMs and generative AIs haven't been trained on yet, or maybe at least not yet, maybe in the future, but it's something that has not been generated yet and hasn't been trained yet. And the place that's been incredibly successful, as an example, are text classifications, right? Being able to take data or text and get that connectivity between different words and different topics and being able to say something about it, being able to take complex contexts and bring that into part of the task that you're doing. This is one of the most popular ways generative AI is being used, is not just querying and getting a result, but saying, hey, here's this piece from this PDF. Can you answer this question about that, right? So it can take very unfiltered or unprocessed contexts and work based on that. And lastly, also, some of the new pushes that's been happening relatively recently in the last few months is being able to do kind of pulling in information from a lot of multi-query places, right? Different databases, different things, throw them all together and being able to do an analysis on that.
Yeah, great overview. And I think you've hit on a couple points, which is, from my point of view, and I think yours, it's not going to entirely change the world overnight. The robots are not going to take over. It's more that it's going to make some very specific tasks or functionality much more efficient. And I'll give you a great example that we use on our team is all the press releases we write now, we run through ChatGPT and it generates a press release and it's pretty close, but it's not good enough to go live. So then the humans, specifically me and my boss, Vicky, have to actually go and polish that up a little bit before it goes live. And that's a perfect example of what generative AI can do, which is it can take some input, use the artificial brain behind it, polish it up quite a bit, give you roughly what you need, that kind of 80, 90, 95%, but you still need some humans to make sure it's accurate. But it's also really important to point out that it's more than ChatGPT, right? ChatGPT is kind of getting all the headlines right now, but there's a lot more uses for Gen AI. So behind the scenes, we're seeing things like video game music, the background music you hear in video games. People are starting to use Gen AI to generate that automatically and then tune it as needed. We're seeing it in industrial design and predictive maintenance to make sure that factories, for example, are running efficiently, getting updates, et cetera. We're seeing it used in fraud detection and response, things like that. And in this case, we're actually seeing it in the image generation. All these images over to the right were generated by a generative AI image creation engine. But I think it gives a really good example of what's good and bad there. They are cool images, they're interesting, but they have some very, very clear flaws. The words here, or even the language they're written in, isn't a real language. It's an imitation of what's out there. So you still need humans to go and take this content and polish it to a point where it is usable. So with that in mind, Daniel, let's dive a little bit down to the next level, which is not necessarily cybersecurity yet, but how is generative AI being used in the broader healthcare community? If you can start with administrative work at first, that would be helpful.
Yeah, I think the places that it's been adopted relatively quickly, and this makes a lot of sense considering the need to have a lot of caution in adopting new technologies in places that are clinical and places that are patient-facing and places where misusing this technology can impact patient care. So that one of the first places that this is being implemented is around helping organizations and health organizations being more efficient in how they're administrating all the data and paperwork that goes on with patient care, right? This includes things of clinical coding, making sure doctors are doing the right coding for the right treatments, verifying that and making sure that the information is flowing correctly across the insurance providers, helping pre-approve based on things coming in from the patients or based on things in the patient's medical records, and helping with things like claims handling and just making kind of helping to grease the wheels of how the bureaucracy and all the needed that were usually till now required a lot of people to be involved in these processes and allow them to be more efficient and helps the healthcare organizations spend more resource in other places. Another one is patient communication. There have been quite a few startups, and we've seen quite a few medical organizations rolling this out where kind of help trigger by the treatment at home that became very popular during COVID time, right? And helping to make sure that that doesn't require as many physicians or doctors behind the scenes or nurses to facilitate that by having generative AI-based communication with a customer, they can or with the patient. They can know when a patient might be feeling pain, or maybe the medication isn't working properly, or maybe they need to be brought in, kind of understanding what their experience is with the treatment that they're getting or with the physiotherapy that they're getting, helping them to schedule things, which is sometimes difficult with more complicated places in terms of interacting with the organization. And this, again, reduces friction, helps keep an eye on patients when they're outside the hospital, and helps, again, efficiency of healthcare organizations. And lastly, this is one that I found very interesting, is with the hesitancy to implement this into actual clinical places, and it'll take a little bit more time until this technology can actually be used in places that are clinically relevant for patients, where it can really help improve accuracy is by helping to train and simulate our doctors, our nurses, and our caregivers in a way that is considerably more risk-free than what we have nowadays, where pretty much you have to intern and work with patients and sometimes sadly make mistakes. And this will allow us to really up our game in terms of how well trained our medical people are, and being able to improve them and maybe even score them in a way that will allow us to track it without needing to have them be as involved in the day-to-day patient treatment.
Yeah, and I find that last point fascinating as well, which is when you're performing a surgery, say there's so much that can happen there, only so much of that can be handled in predetermined simulations. By adding Gen AI in there and making it a more dynamic, somewhat more random environment, you're just gonna get better effective training. And that's probably going to be one of the biggest takeaways, which is we're going to have medical professionals that have more experience before they even start touching patients. And that's going to be really, really beneficial for all of us. So sticking on Gen AI, let's talk a little bit about some of the research projects going on. And I know you're very familiar with MedPalm2 and SecPalm from Google. So can you explain a little bit about what they are, first of all, and then second, how they're being used, and then how we're starting to use them?
Yeah. So I think the interesting piece is generative AI and LLMs in particular have been, and specifically LLMs have been very, very popular as a more general solution. Basically, if you as a user of LLMs are taking these models and you want to use them in a more specific way, it ends up not being worth it to kind of do some kind of additional fine tuning and training. And you end up just usually using them as they are and adding the context and knowing how to query them to get the solutions that you need. The next stage, which is interesting to see starting to roll out across the ecosystem and with Google's MedPalm and SecPalm specifically, is having LLMs that are trained in a more vertical specific way, and that would allow them to really up their ability to be accurate in these specific fields. So the place that and what's interesting for me are the two fields and the two verticals that Google started out with, right? Which is the first one was the medical healthcare field, and the second one was the security field, as those are the places that they found these specific LLMs to probably be the most effective and have a lot of data to be able to train them on to be able to make them effective, right? Which is fortunate for us and also makes sense for us from kind of how we see the cybersecurity and healthcare fields. So the way they're being used is kind of what I said earlier, right? If you're taking a generative AI and you're just throwing it at a picture and asking about an X-ray, it will probably not be able to be very successful. If you have medical data and you can train it significantly on that data, that allows you to ask more vertical or more specific questions and be able to get more accurate answers. So they're using it to help hospital caretakers get more accurate diagnoses, ask questions about information that till now doctors had to kind of keep in their head, right? They learn a huge amount of data, they have to remember it, and when things come up, they have to kind of keep pulling it out. So kind of helping doctors being able to get the start of what they need to kind of help do the diagnosis they need for the patients, and also helping to generate the clinical answer that they need for patients based on this stuff. So I found that to be very interesting and hopefully very empowering to doctors, and again, helping them do their job better, not in any way replacing them, and then helping them get access to the data that they need in a way that is more efficient and easier for them. And the second place we're seeing this being used is on SecPalm, which the security piece, which is based on basically information on vulnerabilities, information on what's malicious code, information on how these security solutions are being used and how customers are responding to security incidents. And again, that's a place where it's very valuable to come, hey, let's find anomalies in this text-based logs or text-based information that we have, or let's help customers automate how they respond to a security incident that happens in their environment. How do they need to respond? A lot of these responses would be based on the first thing the customer would do would be search on Google for the information about this incident. Well, why do that? We can give that information, have it more tailor-made for the customer, and enable them to better know how to respond to incidents. So that's kind of how Google is using this information that they have about these specific verticals to help organizations that need them, whether it's medical device or healthcare organization or security organizations such as ourselves, provide a better product to our customers.
And you had a couple of really good points there that I just want to point out for the audience. One is if you get a chance in the audience, I highly recommend everyone take just 10 or 15 minutes, go to the MedPalm2 website and look at some of the examples of how MedPalm is being used to make physicians' lives better, just make them more efficient, because some of the write-ups they're doing, some of the generative information they're providing is incredibly accurate and just needs a couple little tweaks. And you can see how it may take a doctor going from 10 minutes of writing down to 2 minutes of writing, and that just means they can see more patients. So the examples they have there are great. It does come down to efficiency and making sure that, as we have unfortunately shrinking rates of participation in the medical field, that those people can do more with the skill sets they have. And then finally, Daniel, you started off by talking about an almost swirl of activity, right? We sit right at the intersection of healthcare and cybersecurity and cyber attacks. And almost magically, I know it's not magic, it's research, it's investment, all that stuff, but it almost seems like magic where these great new resources in terms of MedPalm and SecPalm have landed in our lap and now are making our technology and the whole field's technology much better. So I highly recommend anyone watching this, go take a look at those, even for 10 or 15 minutes. In true Google style, they make really complex topics relatively easy to understand, and they're very, very impressive. So we've talked about what is Gen AI. We've talked about how is Gen AI helping healthcare today, where is it going? Let's dive even deeper now. Let's talk about how it's being used specifically to secure healthcare environments. And to lead this off, I want to talk a little bit about what the goals of healthcare cybersecurity are, because if we don't understand the goals, we can't understand actually what we're doing. So at the end of the day, our goals are protection. We want to protect patients. We want to protect the availability and quality of care. We want to protect facilities. And whether we like it or not, we want to protect finances. If we can't protect the finances, particularly in the US, where it's mostly for-profit hospitals, those hospitals will close. And that's not an exaggeration. We have seen a hospital close recently in Illinois because they could not pay their bills due to a cyber attack. So what we're really trying to protect is the existence and the care provided by those hospitals. So when we individually go in, we can get the best care possible. So when we look at it, there's a couple different areas where we have traditionally focused or are starting to focus. One is traditional IT, the firewalls, NACs, et cetera, that have been around for a while, and we're not going to talk about too much today. But as we dive deeper into where attacks are actually happening, they're happening on connected devices, IoT and IOMT. So again, I mentioned them earlier, but this can be IV pumps, this can be security cameras, Teslas, Amazon Alexas, CT machines, all those devices providing cares that are not necessarily a laptop or a Windows machine that we traditionally think of. Those make up nearly half of the devices in a hospital in some cases, and they're wholly unprotected. So we need to start taking those into account more. We're also starting to see that detecting attacks is becoming critical because attacks aren't getting past those traditional IT systems and then beginning to spread. So we have to not only detect them quicker, but detect the spread more quickly as well. Because if we can stop the spread to even 1 or 2 devices, we get to a situation where those 1 or 2 devices might be operating suboptimally for a couple hours, rather than a whole hospital system being out of commission for months and costing tens of millions of dollars. And then finally, we want to make sure that the impact is negative, that goes along with attacking the spread, and that we're taking proactive measures. We don't want this to be entirely reactive. Ideally, we have many, many proactive measures in place, and then a reactive incident here and there to handle. So with that in mind, Daniel, I want you to talk a little bit about kind of the 3 pillars we're seeing Gen AI being used for in healthcare cybersecurity. So if you can start with the left and go to the right, that'd be great.
Right. So the first one, and I think this is probably the easiest one, right, the lowest hanging fruit, and that is providing to customers. At the end of the day, most cybersecurity solutions are data solutions. At the end of the day, except for like enforcement solutions like firewalls, right? But most actual cybersecurity solutions are based on a lot of data and enabling the customer to see the data, seeing alerting based on the data, and kind of getting access to what's actually going on in their environment, whether it's a networking solution, an endpoint solution, an email security solution, or whatever it is. So we're seeing a lot of work being done, and Microsoft also published something from their side on it, their security co-pilot solution. So that's something we're seeing across the industry, is more and more kind of co-pilot type solutions that work with a customer on their existing solutions to help them get the right data they need from the solution, and to help derive the right insights from those data. So you can less than trying to figure out what the user experience of the solution is, you can just query it and help getting the information you need, less Googling around, less asking around to what that incident means, how do you get the data that would be relevant for your organizations, and so forth. So there's a lot of helping to empower organizations that might not necessarily have a huge cybersecurity team, might not necessarily have the time to go through intensive training for all their different cybersecurity solutions, and now they can, with more ease, get the value they need out of their existing cybersecurity solutions, which Right? If you're an organization, you have 20 solutions, that could be a significant time saver from that regard. So that's the first piece. The second piece would be kind of the algorithms used in the backend analysis, right? So generative AI is helping a lot of cybersecurity solutions that kind of what I mentioned earlier, that might have had a lot of work on their hands to take the data that they have or getting access to the data and allowing them to roll out actual detections and being able to detect whether it's detecting anomalies or helping them classify stuff as malware or not malware, and being able to pull with relative ease kind of new engines, new detections, new classifications into their solution. And it's in addition to that, it's also pulling in all that information that exists out there around cybersecurity. So there's a lot of information about existing attacks. There's a lot of information when a vulnerability comes out, information from vendors. There's a lot of this type of information that companies have been doing a lot of manual work to take that, pull that in, massage the data, figure it out, and trying to get all that data out to get a, for example, accurate IOC or accurate rule to detect an attack on the network. That would take a lot of manpower and resources, and that's something that's much easier now and allows companies, to build products that are leveraging this with significantly less resources than they needed to in the past. And the last piece is the human element. In our company, call it Cynerio Live. It's our cybersecurity analyst, but pretty much most good cybersecurity companies have a human element that needs to look over, help customers with actual attacks that are happening, to help do the research and looking at that data, the stuff that I mentioned a minute earlier in the backend analysis, that kind of helps drive their organization forward. And this is just like any like developer helping a kind of solution, the way it's being used to help developers. Similarly, it's helping by researchers being able to do the research quicker, helping them get information on systems they haven't been familiar with quicker, helping them get access through all the data that the product has from the customer, and saying, hey, this is something that should be researched in a much easier way.
And to that last point, we actually have a really great webinar that we did with TechNation Webinar Wednesday. So if anyone wants to see how our research team is stopping attacks, I believe that was back in April, reach out to myself, reach out to Linda on the TechNation team. We can certainly forward that along because it goes very deep into how this is helping, how our research is stopping attacks, and then a little bit into Gen AI there. Additionally, with the backend analysis, that's really hard to show, but if anyone wants more details, reach out and we'll be happy to give a bit more detail and dive deeper. But Daniel, I do want you to talk more about the front end because it's kind of easy to visualize. So can you talk a little bit about how Gen AI is helping to do things like speeding device insight?
Yeah, so at the end of the day, customers are using our solution. A lot of the work is to try and get the data that they want about the organization. Here's a great example of, hey, I want to know which devices from a specific vendor, from a specific site need updating. And that's something that every solution would be pretty easy to get to that data once you learned it, once you know how to click through it, once you figure out all the ins and outs of that solution. And it sounds simple, but you have to know how to do all the filters and go through all the screens and wait, how do I create this report and all that? And being able to give customers the ability to just very easily, without a lot of training, get access to that data and easily click through and get the results, create the weekly report they need, being able to get the right widgets or the right dashboard to give them a high-level overview for this project that might be relevant for upgrading all the devices from a specific vendor, the specific site, we find to be extremely valuable. And it's even more so because our solution is an integration-first solution. So we will integrate with anything and everything that you want us to integrate with. So we can pull all that information into our solution. And then we can help you have better access to your data in other solutions in our solution by pulling that in, right? So you can query that data based on the location of the device or based on the CMMS data or any type of security tool that might have tagged the devices one way or the other. And that really makes our tool as an empowering to you as customers to be able to get the data you need quicker.
And anyone that's ever used a security dashboard is familiar with 20, 30, 40 clicks trying to find the data and then just giving up, downloading the Excel file and going through there. This takes that away. This allows you to go in, type exactly what you're looking for, and then boom, here are 4 or 5 reports that are going to give you exactly that data. And that's incredibly powerful, makes you more efficient, and at the end of the day, allows you to implement more security controls. And if you can talk a little bit more about the advanced analysis in Copilot here, that'd be helpful as well.
Yeah, so at the end of the day, when there's a new risk coming out, the next Log4Shell, which hopefully won't come, but sadly probably will, or the new or there's a new attack or a new ransomware that's going out there, the thing that will help your organization is making sure your time to response is as shorter as possible. So you need to be able to have an outlook on your in your data or in our solution on very quickly understanding what are the devices that are susceptible to this new ransomware that's going around. How do I respond to them quickly? What impact will this have to my organization? And what are the network level or device level mitigations that I need to apply? And how do I apply them as quickly as possible? And similarly, if there's an attack or if there's an incident, right? The idea is to put in your hands as quickly as possible the action items that you need to do to improve your organization. Again, it's existing in the solution. It's existing in any cybersecurity solution. At the end of the day, one of the big things that we've seen with the customers that we worked through that had more traditional cybersecurity attacks is they knew about the attacks, they got the notification, but it got buried under a lot of noise and under a lot of other attacks and things that they didn't even know how to respond or what it meant. The idea is to make sure that we bubble up the most critical things that need to happen as soon as possible, pulling in information from all the different places that we have that information in a way that's actionable.
And we have a great customer example where their goal each month is to reduce 5% of the risk they see. And some months they hit it, some months they don't, but they can go into a dashboard like this, say, hey, give me the most critical risks with the easiest fixes or something like that, and they get it right there. So they know that not only are they going after their 5%, but they're spending that time wisely on the issues that will most impact their hospital if they are attacked. And I think it's really important. We said ransomware, I think, for the 100th time now on this call, but it is on top of everyone's mind. But it's important to remember that it's not just the good guys. It's not just the security practitioners that are using these tools. Hackers are evil people, but they're not stupid. They use these tools as well. So we need to realize that not only are they using them, but learn about how they're using them so we can better protect. So Dan, if you can give a couple examples of how hackers are using this, I think it might be helpful.
Yeah, so at the end of the day, generative AI helps a lot of different people to empower them to be more efficient, to be better at their job, whether it's healthcare practitioners, whether it's cybersecurity personnel, or whether it's coders. And a lot of hackers, when they want to write malware, they're also coders. So while it's helping coders write better tools, it's also helping malware authors write better malware and easier, letting people that might have been a junior malware author to now be a much more successful malware author to be able to write the tools that would be relevant to attack organizations. And it's also generating other things, right? It's about one of the things that has always been difficult for attackers, for example, with spear phishing or anything like that, or any other type of phishing, was how do you create something that looks realistic enough, that looks that doesn't look repetitive enough, that looks in a way that's convincing enough that people will engage. Or how do you do a malware that doesn't look like a malware, right? That has enough assets and tools and looks like a real solution. So by hackers using generative AI to generate the email, to generate the communication, to generate what they need to surround their malware and their tool, they can create something that looks much more realistic, working as if there is much more man hours behind it than there actually is. And this takes a lot of the tools used previously to help detect spray and pray type malware, right? If you're talking about a phishing email, right? There's a lot of finding the easy stuff. It's going to make a lot of those tools' job much harder. As right now, you don't need to sit and write a specific email per person. You can use generative AI to do that for you.
And is often the case, some of the greatest weaknesses are the greatest strengths and vice versa. So, attackers are using this. We have some idea about how they're using it. That's going to change over time, but we can also use it to generate the protections against them as well. So our team will continue to do so and hopefully help everyone. So shifting gears a little bit, great deep dive, Daniel, really, really appreciate it. Let's talk a little bit about what folks can do if they want to get started. So first, and I'm going to start from the right here and go left. First, if you want to book a demo, if you want to learn more about this, if you would just want to ask our team questions, you can ask a question now. I'll do my best to answer it at the end. But if you want to book a demo and dive a bit deeper, just let us know. Raise your hand. I'll give you my email address here in a second. We'll be happy to dive in deeper, tell you how we're using Gen AI, tell you what some of our plans are, and just kind of inform you about what's happening in the industry. Next, if you are a biomed or HTM team member and you want to get started with security, but you're not quite sure how to do it, we do have a cool offering I'll talk about just in a second called the CMMS analysis. Effectively, give us your database of devices. We don't need the whole database. We don't need direct access. We need a subset of that info, and we can give you very detailed information about the risks you're facing and how to fix those risks. And then finally, if you do want to get started right now and you're afraid of active attacks that might be happening or want to prevent against them, we do have active attack detection where we can monitor your network traffic in a secure, non-intrusive way and identify where things like malware may be trying to spread. So first, if you do want to get started with that active detection, very straightforward. We will go in, work with you, monitor your network traffic for a brief amount of time, identify any risks that you may have. Occasionally, we will identify points of exposed EPHI. So if you have a PAC system, for example, which is notorious for exposing EPHI, we can identify that and help you make sure that that data is not going to the wrong place. And we can also give you recommended actions on how to protect against attacks or exposure of that data. So if you do want to learn more about that offering, reach out to me at chad.holmes@cynerio.com. Additionally, if you are on a biomed or HTM team and you do want to get started with a better understanding of what devices not only that you have, but what risks they have, you can see here we can generate a pretty in-depth report with relatively little data. If you give us 2 or 3 specific fields from your CMMS, we can take that, run that against our large data set of analysis we've done across our entire customer base, identify risks, identify where you may need new patches, identify where configurations need to be changed, and show you the full mapping of those devices. It is a great first step to actually going and starting a bigger security effort, particularly at the device level. So again, if you do want to learn more, you can reach out to me at chad.holmes@cynerio.com. And so with that, I thank you all for coming. Daniel, thank you for your time today. Really, really appreciate it. Linda, I've seen a bunch of questions have come in, so I'm going to hand it over to you and we'll answer some of those questions. Linda, over to you.
Thank you so much, Chad. We have actually got a few questions that have come in. The first question is, how are companies protecting patients from the inaccuracies and errors that are starting to be seen in generative AI?
Oh, generative AI. So sorry to correct you there, Linda. So one of the good things is generative AI is analyzing a lot of data, generating a lot of solutions, in our case, security policies. But people are taking a very realistic approach to adopting it. So it's not like we're just taking the technology and saying, hey, let it run loose on patients and hopefully it cares for them. So there are very high levels of quality control. If you go back to the examples that we saw during the discussion with Daniel, a lot of the things that are happening right now are very much administrative. So if an appointment gets canceled or an appointment is scheduled for the wrong time, irritating, but it's probably not going to hurt a patient all that much. So we are seeing a very hands-on approach to quality control of generative AI and making sure that any issues that arise are caught before they get to the human level. That will obviously change over time, but I don't see a lot of just rapid, hey, stick it on the humans and let's hope nothing bad happens. People are being very realistic about the adoption.
Okay, so many of the healthcare use cases given were not directly involved in patient care. When will the leap be made from administrative uses to patient care uses?
Yeah, and I think if you think back to I think it was the third example that was there, where we're actually using it for training now. So it used to be that non-human based training, meaning a doctor in training would go in, they'd be performing surgery of some type on a dummy, for example. Gen AI is being used to modify how that training is happening. It's making it more random, it's making it more lifelike. So we'll continue to see it focused more on that. That's going to be the entryway into the healthcare world. We're also seeing it more on the research and development side, where genetics companies or pharmaceuticals are using it as well. So it may not be pointed directly at patients in the very near future, although I'm sure if you Google a few articles, you'll find at least a couple examples that contradict me there. But it probably won't be focused on in a widespread way. We'll see more of a easing into direct patient interactions.
Okay, so how could Gen AI help in cases like Prospect Medical earlier this month, where nearly a dozen hospitals across the US had services impacted?
Yeah, and for anyone not aware, Prospect Medical is a California company, but they have hospitals in, I think it's 5 or 6 different states. And effectively, a couple of hospitals got breached. The attack went widespread, took the hospitals offline. They're still in the middle of cleanup from that. Kind of what Daniel was talking about earlier in particular is really important because all that traffic, the traffic that allowed the attacks to hop from hospital to hospital to hospital, can be better analyzed. It can detect malicious activity. We just have to point generative AI to look at that traffic and understand what malicious activity looks like. So had they had a protection in place that was one, analyzing their network traffic, and then two, using something like Gen AI to more efficiently filter out the good and the bad traffic, that may have been stopped in a matter of hours and we never would have heard about it. If you look at some of our previous Webinar Wednesday sessions that we've done, we've talked about attacks like that, where we have things like a treadmill will be attacked, and we'll take the treadmill offline, we'll factory reset and get it back online in a matter of 2 hours. So we've gone from a minor inconvenience for 2 or 3 patients, or we've limited it to a minor inconvenience for 2 or 3 patients rather than a widespread attack. So the reality is, Gen AI is helping people today. Folks like our customers are seeing the benefits of it. It just needs security protections need to be more widely adopted within the healthcare space.
Okay, great. Another question here is, when will customers start seeing AI in our console?
Yeah, in the Cynerio console, they will. We have a customer demo. I think it's a week from today, so August 30th. Yeah, they will see what that looks like in our console in the next week or so.
Perfect. Okay, another question here is a bit long, but bear with me. A lot of AIs are using learning techniques to improve their quality by reading different sources to teach their AI. Many of these companies have been facing lawsuits for copyright or privacy infringements from the author of the source, not even providing approval for their AI to learn off it. Do you feel that AI system could face the same roadblocks? If so, do you have plans to address those roadblocks?
Yeah, I wish Daniel could join us for this part of it because he has a really good answer. I'm going to try to give you the best version of that answer I can, but Daniel has the much deeper technical answer there. Effectively, the way that we and others are using the generative AI models is it allows us to give it a data set to work with. So in our case, all the traffic we've ever analyzed, but we don't have to go and ship that outside our walls. We use that locally, and then it gives us a language to actually go and analyze that data. So if you think of something like ChatGPT, that's pulled from the broader set of information available, books, magazine articles, millions of different sources. That's where you start to get into really big issues around copyright issues or who owns what. When you use it more like we're doing, where you look at the data set we've worked with, that we've been able to say, hey, this is a valid issue, this is a false positive, let's eliminate that. Copyright issues don't really exist because we have a very, very narrow scope, still a large data set, but a narrow scope of data that we're looking at. So we're not pulling in things that may lead to legal issues, copyright infringement issues, et cetera. If you want a deeper answer, let me know, shoot me an email, and I can get Daniel to give you the deeper answer. But effectively, it comes down to the data sets you're pulling from and how you're analyzing those.
Okay, that's great. Another question here, it's a kind of general question. What would you regard as a ballpark cost of cybersecurity protection at a hospital? Would that be per protected device or what?
Good question. So I was on a working group call the other day, and more and more hospitals are getting CISOs. So this was a group of CISOs and other folks, and they were talking about the same question. And it's unusual this happened, but they all agreed on one thing. They all agreed they should be spending more, right? Kind of smart aleck answer there. But the reality is that there is no baseline that we're seeing. Across the board, we see it's generally accepted that hospitals are spending 2 to 5% of their overall budget on IT. Within that, cybersecurity is somewhere in the 5 to 10% range. So at a high level, you're spending just a very, very small amount on cybersecurity overall. Additionally, this question asks a really good point, which is how do you even measure what you should be spending? If we look at a per protected device instance, for example, we find numerous devices in every environment we go to that no one knows are there. Alexas, Teslas, video cameras, just a bunch of things that no one's tracking. So tying it to actual device spending is hard. So what we're seeing is there's a general trend in the industry to accept that there's roughly 10 devices per bed out there. So there's a shift to per bed pricing rather than per device pricing. So I can't give you a hard and fast answer here. What I can say is that spending should be split between IT and IoT evenly because the technologies roughly are. That is heavily skewed towards IT right now, and it should probably be at least 5% of the overall budget, more likely closer to 10%, but that would be a very, very big stretch for most hospitals.
Perfect. Now, before we wrap up, Chad, is there anything you want to summarize or expand on?
Yeah, absolutely. So first of all, generative AI, great technology. It is incredibly healthy to be skeptical about it. It's very valuable to do that. If anyone would like to learn more about how we're using it, how we're adopting it, or have the more general discussion about how it's being used in healthcare, we would love to have that with you. So again, just reach out to me at chad.holmes@cynerio.com. I can find the right folks to get on the phone and we can go from there.
Perfect. Thank you so much, Chad, for your time today and for a really great and informative presentation. I'd like to encourage everyone to visit Cynerio's website today to learn more about the services they provide to the industry. So please visit cynerio.com. As promised, the answer to today's trivia question is brown. So congratulations to our winner, Ryan Gonzalez. Just a quick reminder, you can obtain your C certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1C credit from the ACI, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. We'll be back next week with another webinar, so please visit webinarwednesday.live for more details and complimentary registration. Thank you once again for your time today and enjoy the rest of your day.
Thank you, everyone.